My name is Darielle and I'm a fourth year medical student making this video about my research project titled Indigenous Cultural Competence Training Effectiveness for Doctors Working in Kalgoorlie Hospital. The project will involve implementing an Indigenous cultural awareness program and evaluating its effectiveness. The literature outlined in the grant proposal found that with no appropriate training in Aboriginal health, practitioners inadvertently exacerbated the stress and pain of Indigenous patients. Patients were increasingly misunderstood, did not attend follow-up as often, and more discharged against medical advice. These outcomes directly related to poorer health, thus potentiating the health disparities between Indigenous and non-Indigenous patients. A systematic literature review also confirmed that cultural training increased the competence level of healthcare providers and significantly increased patient satisfaction. Kalgoorlie is being used as it has a large number of Indigenous patients and a high turnover of doctors. It is a relatively easy project to implement as the only costs needed are for the wages of the 3 research personnel. This includes 2 Indigenous health practitioners who will facilitate a case-based component of the course, and a local Indigenous trainer who will take 5 one-hour tutorials. The course will run in 10-week blocks with new participants every block for 12 months. A survey created by the Centre for Aboriginal Dental and Medical Health at the University of Western Australia will be used to analyse self-perceived competence in regards to practice with Indigenous patients. It will be taken by the participants at the beginning and at the end of each course, with a mean score being recorded for each survey and the results compared to note any improvements. This will be done by a medical student at no cost as a requirement for their degree. It is hoped that if the program produces improvements in practice, that similar programs could be rolled out to other WA health hospitals and provide employment for more Indigenous trainers, giving them a platform to be directly involved in the information being taught to practitioners about what they hope to receive as patients. Thank you.